Swadika, good evening. This is Thai PBS World Tonight. You are now with Kertesz and me, Natha Gomonwatin.
Good evening, and more cases of coronavirus infections have been reported today, both in Thailand and the rest of the world. And it looks like more and more government leaders and well-known figures are working from home these days.
Yes, it seems nobody is safe right now because from the highest level of the government, the world leaders to sport people, celebrities, there are reported that some of them have already been infected by COVID-19.
And the best alternative now is to work online. That means working from home in a way that is sort of self-quarantine.
Yes, yes. All over the world, the total number of infected cases is about 130,000. And especially the death toll in Italy has passes 1,000 already. And we can see how the whole country was locked down in order to impose strict measure to the population. Also, one capital in Southeast Asia, Kertesz, Manila, also announced to lock down as well.
And let's take a look at some of the more prominent people who have reported infections in the past few days. Of course, the biggest piece of news this morning was the case with Sophie Gregor Trudeau, wife of Canada's Prime Minister Justin Trudeau, who came back from Europe with flu-like symptoms and has been tested positive with coronavirus.
Yes, and Prime Minister Justin Trudeau has to isolate himself as well for 14 days, even though the symptom is reported that is quite mild for Sophie Trudeau, the wife of Prime Minister of Canada.
And a statement from the Prime Minister's office in Ottawa said that the Prime Minister's wife is remaining in isolation for the time being and is taking all the recommended precautions, and her symptoms, as Kunata said, still remains mild.
Yes, and reported that Justin Trudeau is in good health and with no symptoms.
Canada has more than 100 confirmed coronavirus cases, at least with one death. And the latest patient is a baby boy who was in contact with an infected person at a Toronto hospital, according to local media report.
And other cases that we have to keep looking out for, like 121 people at Italy Juventus fan club are self-isolating after footballer Daniel Rugani tested positive for the virus. And there is heightened concern at the White House after picture emerged of a top Brazilian government aide who has tested positive for coronavirus, standing right next to Donald Trump, President of the United States, at Mar-a-Lago last weekend.
That's right. In fact, President Trump has been under fire for being seen as having taken the situation too lightly. I mean, he tried very hard to shrug off the threat from the virus, but today he was quoted as telling people close to him that he is now concerned with coming into contact with people who have contracted the coronavirus.
Yes.
There's such a change of mind on the part of the President of the US as far as the disease is concerned.
Yes. Yesterday he has press conference and imposed travel ban, travel restriction of European Union citizens who would like to enter the US. The suspension of travel will last for 30 days. And also, Arsenal coach Mike Arteta has coronavirus as well, and in a statement, the club said they expected a significant number of people, including the full first team squad, will have to self-isolate. Meanwhile, the Premier League is holding an emergency meeting tomorrow morning, but all the season of Premier League has to be cancelled. That's the latest report we have got.
And in New York, a female diplomat from the Philippines mission to the United Nations tested positive for coronavirus on Thursday, that means yesterday, according to a note sent to UN missions. making her the first known case at the world's body's New York headquarters.
Yes.
And that has led to a lockdown of the Philippine mission.
Yeah, and the situation in the UK is getting more attention, especially from the Prime Minister of UK, Boris Johnson, also addressed the whole nation, even though he stopped short of announcing it as emergency situation.
It's clear that coronavirus COVID-19 continues and will continue to spread across the world and our country over the next few months. We've done what can be done to contain this disease, and this has brought us valuable time, but it's now a global pandemic, and the number of cases will rise sharply. Indeed, the true number of cases is higher, perhaps much higher than the number of cases we have so far confirmed with tests. And I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous, and it's going to spread further. And I must level with you, level with the British public. More families, many more families, are going to lose loved ones.
A dire warning from the UK Prime Minister.
Yes.
He couldn't have done more than to underscore the dangers of this ravaging the disease.
Yes. Right now it seems all the leaders, especially in Europe, is quite alert regarding the COVID-19 outbreak. Also, another leader, President Emmanuel Macron from France, also addressed the whole nation, and he announced that this is emergency situation.
Et jusqu'à nouvel ordre, les crèches, les écoles, les collèges, les lycées et les universités seront fermés. Pour une raison simple, nos enfants et nos plus jeunes, selon les scientifiques toujours, sont celles et ceux qui propagent, semble-t-il, le plus rapidement le virus, même si pour les enfants, ils n'ont parfois pas de symptômes. Et heureusement, ne semblent pas aujourd'hui souffrir de forme aiguë de la maladie.
President Macron announced the closure of all the country's schools, colleges, and universities as part of strong measures to address an expected acceleration in the number of people with the virus. He described the outbreak as the most serious health crisis France had faced in a century. Another country in which the leader is also having alert all over the country is Angela Merkel from Germany. She held a press conference where she appealed to Germans to restrict social contact and announced plans to restructure the country's hospitals in order to boost the number of intensive care beds. Meanwhile, schools in Belgium will close from midnight tomorrow until the Easter holidays. Belgian Prime Minister made the announcement. Restaurants and bars have also been ordered to close, and only essential shops such as supermarkets and pharmacies may stay open. So that's the latest update from all over the world, like what's going on, highest level of the government also infected because of COVID-19.
Even though in Thailand the situation may not be as bad as that in European countries, but the number of cases of infection keep rising, and today 5 new cases of COVID-19 have been reported.
Yes, especially the 2 new cases are related with the 11 cases reported yesterday, because they are acquainted group of the 11 who were infected yesterday.
That's right. The Undersecretary of the Public Health Ministry, Dr. Sukhum Kanjanapimai, described the new cases as what is called cluster infections, and that is another development of the spread of the disease. He said that 2 of the 5 new infections, Akunata said, are related to a group of 11 Thais who became infected after sharing drinks and cigarettes with a friend from Hong Kong. The 3 others include a Thai woman who returned from South Korea, where she had a plastic surgery and later went out to an entertainment venue in Bangkok. And the other 2 are her younger brother, who lives in the same house, and a close friend of hers.
Yes, and another obvious case, and probably we can say that the most infected case in Thailand at the moment is from an actor, Matthew Dean. He posted his own photo, video image on Instagram and announced that this is serious because he was checked up. He had a medical checkup, and he told us that he is infected with COVID-19. And he told that today the boxing camp, which called Kong Sittha, his own boxing camp, will have a hygiene cleansing for the whole day today. But his case is being raised by Public Health Ministry. Like, where did he have the medical checkup, and how could he have proof that he's really infected with the COVID-19? That's been asked by the doctor as well, because if you take a look from the clothes he's wearing, it's not patient clothes. So perhaps that will have to have more evidence coming out from Matthew Dean. But right now, all the people who have been in touch with him in the past few days or in the past week perhaps need to be alert and see and have medical checkup. Yes. And in order to try to get a glimpse, get more insight for the whole world, not only in Thailand, but overall situation globally regarding COVID-19, since the day one that it was found in November, up until now, China announced that it has reached peak point already and the situation may be getting better. But what's the real situation right now? We have WHO representative to Thailand with us in the studio, Dr. Daniel Kertesz. Thank you very much, Dr. Daniel, for joining us.
Thanks so much for having me here. It's a real pleasure.
Okay. When we met earlier this evening, we didn't shake hands, we just wine, right?
Yeah,
I guess
we can bump elbows if you want, or knees.
Yes, it's going to be the way people will greet each other for some time.
I would love to shake your hand, but let's not.
But you haven't shaken hands with people in recent days, have you?
We tend to avoid shaking hands in times like this. Yeah.
Okay.
Yes.
You would advise people to do that also?
I think it's really advisable for people to try and, as much as they possibly can, to distance themselves from others by at least a meter. I think that's something safe to do. I think it's sensible, and I think it's not forever, but I think as a temporary measure, it's very important.
At least a meter.
We say at least a meter.
So we are a bit too close.
Well, yeah, we're a little bit close, but that's okay.
Okay.
Yes. So right now in Thailand, we get 5 more new cases, in which is related to yesterday's case of 11 cases. How alarming that is getting to be of the overall situation in Thailand.
Yeah. So I think, anytime cases of COVID are reported, it's alarming. And I can understand there's a lot of fear and anxiety and confusion out there. I think it really helps for programs like this to talk about COVID and for people to have a chance to understand what's going on. When we look at countries around the world, and I think it is distressing to see the virus that causes COVID spreading around the world, we tend to think of countries as falling into one of 3 categories. We call them cases, clusters, and community. So there are a number of countries in the world, many in fact, that just have sort of 1 or 2 cases, and mostly those cases are imported from other countries. And that's where Thailand was 6 weeks ago, 8 weeks ago. Then we have countries that have transmission in the country, what we call local transmission, in transmission chains or clusters of people, much like we're seeing in Thailand today. So I think the important thing is that in Thailand we're still seeing cases, we're still able to follow most of the cases, able to link them to other cases and to follow their contacts. The final category is community, and that's when the virus starts to spread in the community. We don't know where the virus is coming from. It pops up here, it pops up there. And there are some countries in the world that are currently experiencing that. We see what's happening in Italy, we see what's happening in Iran, and we saw what was happening in China. The most important thing is to do everything we possibly can to prevent or delay the spread of COVID-19 in the community.
Despite what you say, I think we still can afford to be complacent about it, right? Because the cases that have been reported so far, some people say could be just the tip of the iceberg.
Absolutely, absolutely. In fact, we must do the opposite of being complacent. We must redouble our efforts everywhere, everywhere, to try and identify cases. I mean, the real key is identifying cases quickly, isolating them as quickly as possible, treating them appropriately, and then tracing their contacts. The faster you can get cases who start to show symptoms, the faster you can get them isolated from other people, the less chance the virus has of being transmitted from person to person. This is what we must do. We must attempt to interrupt the transmission or stop the transmission of this virus.
So what we saw the practice in South Korea, in which they check from people who sit in the car and have all the medical equipment ready to check people. So that must be the right way to identify on the spot quite fast.
Absolutely. I think Thailand has done a very, very good job of testing people who have traveled, who develop symptoms, who've traveled, who've been in close contact with people who've traveled, and people who are in professions that might bring them in contact with tourists or people that have traveled. The more testing we do, the better, because it allows us to identify cases quickly, again, isolate them as quickly as possible, stop the chains of transmission. If we can stop chains of transmission, we can prevent or delay the virus from, we can delay a situation where the virus is spreading in the community. And as I said before, there are many, many countries in the world that have only have a few cases or clusters of cases, and they have a great opportunity if they apply these measures very quickly, these public health measures very quickly, to stop or prevent or delay the onset of community-based transmission of the virus.
Now, with the sudden spike in the number of cases, including many deaths, in hindsight, do you think the World Health Organization should have declared the epidemic, raised the level to be pandemic earlier?
Yeah, we hear that a lot, and it's a good question. But in fact, as my Director General has said, the pandemic, the declaration or calling this a pandemic changes absolutely nothing. It does not change our approach. It doesn't change the way we approach it. It doesn't change how aggressive we are. Again, it is absolutely critical to remind countries and remind people that a vigorous public health response is absolutely critical to delay the onset of transmission in the community. It's so important that we do that, because what we want to try to do by avoiding or delaying the virus becoming widespread in the community is to sort of delay what we call the epidemic peak. So imagine if that you have suddenly a large number of cases very quickly, your health system rapidly becomes overwhelmed, okay? But if you're able to apply these public health measures, if you can slow the onset of the peak, it allows the health system more time to prepare, and it eases the burden on the health system. You don't have that sudden increase in cases, which can quickly overwhelm the health system.
So you mean that right now Thailand is on the right track in terms of encouraging people to have self-quarantine and try not to contact each other for too close, and try to have medical checkup when people feel having related symptoms and then just go to the hospital?
I think, I thought the byline for your program was interesting. No one is safe. I would say that no one is helpless, okay? All people in this country can do something to prevent themselves and others from getting this virus. And it's really very, very, very basic things. It's frequent hand washing, okay? If you don't have access to water and soap, use an alcohol-based hand drum. It's using what we call respiratory etiquette, sneezing into your sleeve or a tissue, and then disposing of the tissue and washing your hands immediately. This protects others, okay? It's avoiding touching your face, your nose, your mouth, okay? And it's keeping this distance, attempting to keep this distance of 1 meter. If we can do that, we can increase our chances of avoiding infection with COVID and many, many other infectious diseases. These measures are so critical. They're within the capacity of every person in Thailand to do, and we highly recommend that these measures be adopted by everyone everywhere.
What about wearing surgical masks? There's been argument as to the pros and cons of wearing it.
Of course.
So can you set the record straight as to whether or not we need to wear surgical masks if we are healthy and nothing wrong with us?
Right. It's really important to wear a mask if under two circumstances. If you're feeling unwell. If people feel unwell, they should immediately isolate themselves from others and put on a mask. That's really critical. The second indication for wearing a mask is if you are a healthcare worker taking care of patients, or if you're taking care of somebody who's ill at home. Okay, you should wear a mask. It's less important to wear a mask if you're feeling healthy, but we understand that in many cultures, especially in Asia, people feel that wearing a mask is protective, and so that's fine, but as long as people remember two things. The first is it's very important to use masks correctly. You must know how to put the mask on. Okay. You must know how to take the mask off correctly. And the second, perhaps the most important thing to remember, is that wearing a mask does not substitute for the other measures that I talked about. Washing your hands, the distancing, not touching your nose, your mouth, your face. Sometimes we think that by wearing a mask, people have a sense of complacency. They feel protected. It's extremely important to always remember the other four measures that I talked about.
Today we see how world celebrities and world leaders, some of them have announced that they got infected from their loved one or their close one. What's the recommendation you'd like to tell all the world leaders as well, because they have to be role model, but some of them somehow perhaps refuse to stop shaking hands, for example?
I'm personally affected because the wife of my Prime Minister, I'm a Canadian, the wife of my Prime Minister was diagnosed as having COVID-19. I think we all have to be role models in this situation. I think we all have to, especially our leaders, have to transmit messages that are factual, evidence-based, based on science, calm and reassuring. And they have to not only model, they have to model good behaviors for people. And again, it's those basic things that I talked about. The hand washing, the not touching the hands in the face, the social distancing. These are really important things and very, very important things for leaders everywhere to model.
Yeah. Dr. Daniel, you must have been through the last pandemic in 2009, H1N1. What's the difference between COVID-19 and H1N1?
Yeah, I've been through, with many of my colleagues, I've been through a lot of epidemics, and they all have similarities and they all have differences. I think one of the realities of the world we live in is that any infectious disease anywhere, any new infectious disease, any emerging infectious disease can be in Thailand one day and in Paris the next day. So the world is very small, and these things spread, these things have the potential to spread very rapidly. That's the reality of the world we live in. On the other hand, I think there's a lot of reason to be hopeful. I mean, we knew nothing about this virus 8 weeks ago, and the amount of knowledge that we have accumulated has advanced at the speed of light. I mean, we already have, there have been over 150 papers already published on the virus that causes COVID. Our knowledge is expanding every day. We now have networks of clinicians, infection control practitioners, scientists, epidemiologists working around the clock, communicating with each other all around the world. So we have an unprecedented global capacity to respond to this epidemic. So for that reason, I'm optimistic. But I think that there are many differences. There are still some things we don't know about this virus. We don't fully understand, for instance, as you mentioned before, we don't fully understand how many people in the community actually have the virus, because we suspect that there are many people out there with mild infections who never go to a doctor. I mean, sometimes I get a cough, even a little bit of fever. I stay at home for 24 hours. I actually don't go to the doctor. So we don't know how many of those people are out there, how many of the infections we're not seeing. So we don't have a really good understanding of the extent of the infection.
Earlier in this program, we reported about a celebrity in Thailand who admitted that he was diagnosed as being infected, and then he posted a message on his Facebook telling everyone that what is happening to him, and he said the message is directed at people who have been close to me the past few days. Is it something you would advise people to do if they know that they are infected?
Absolutely. This is exactly what the public health response is. It's really about public health officials identifying cases, and then what they do is they try to identify people that the case has been in contact with in the 14 days prior to the onset of symptoms in the case. That way they can follow the contacts who are well themselves. They follow the contacts every day to see if they themselves develop symptoms, and if they do, they can be isolated quickly. So if you can isolate the cases quickly, and if their contacts become sick, you isolate them quickly, you can stop the transmission of the virus. You can stop people from transmitting the virus one person to the next.
And you shouldn't be shy if you get infected. You have to let everyone know that you are infected, so that people will watch out. And
yeah. We also have to remember, this disease causes mild illness in most people, okay? In 80 to 85% of people, the disease is mild. Okay, we have some fever, sore throat, we may have a cough, dry cough. It may last a couple of weeks, but we get better. It's true that in 15 to 20%, especially the elderly, people who have underlying conditions, the disease can be more serious. But for most of us, the infection is mild and we'll get over it.
Today, 240 Thais who returned recently from South Korea. These were known as illegal immigrants, workers in South Korea. They came back to Thailand, they went through the screening process at the airports. And since March the 9th, they have been quarantined at the naval base in Sattahip, right? But today, all of them, 240 of them are being, I think they're on their way now, back to their hometowns in their respective provinces to be subject to home quarantine. So the next 14 days, these people will be subject to self-quarantine, and according to the official procedure. And we have graphics of that procedure, and would like to have your comment on that, whether this is the proper things, that we are doing or not, right? First of all, of course, they have to be confined to their home for 14 days. And then, of course, and they have to follow the normal procedure of not sharing their utensils with anyone, and not sharing their personal items with anyone in the families. And they will be watched by, monitored by local health officials and health volunteers. And they also be monitored through the application they have been given on their, downloaded on their mobile phones. So, but what the difference between state-sponsored, quarantined, and home quarantine? What is it?
First, I'd like to say that I think this is exactly the right approach. As I understand it, the returnees from Korea are not symptomatic, and people, we feel, or from what we understand so far of this illness, people who are not symptomatic are not effective in transmitting the virus to others. So the idea is to quarantine them, either in a facility where they can be watched very closely, or at home where they can be monitored through an app or through regular visits by a public health person. However it's done, the important thing is to monitor people every day and to identify them as quickly as they develop symptoms, and then isolate them so that they don't transmit the virus to others, because transmission becomes most effective when people develop symptoms. And we know that transmission of COVID is most effective in the first few days after symptoms develop. So the key here is finding the most effective way to trace people who are asymptomatic and identify them as quickly as they can should they develop symptoms themselves.
Now, in fact, people should subject themselves to self-quarantine without being having to be forced to do so by the state, right? If they know that they have the symptoms.
It really depends on the effectiveness of the capacity of the public health system to follow people at home. So if it's possible to follow them at home, okay, and we call, and people who go to other people's homes to follow them are called contact tracers. If it's possible to follow them at home, that can be an effective way of, that's basically called self-quarantine from home, and that's an effective way of dealing with the situation.
In the past few days, we have heard health authorities in Thailand giving assurance that we have not yet reached the stage of the so-called stage 3 of the virus, and nothing we should not worry about it. But in UK, I mean, the country is a step away from reaching the so-called delay phase of the virus. Are we talking about the same thing?
So when I was talking previously about sort of widespread community-based transmission, that's what we mean by phase 3. That's what we call phase 3 in Thailand. And it turns out that phase 3 or community-based transmission may occur in a country in a local area, in one area of the country, but not in others. And I think this was a big lesson in China. We saw sort of extensive, widespread community-based transmission in Hubei province around Wuhan. But we didn't see that kind of transmission in other provinces. Okay, so the measures that were applied in Wuhan, in Hubei, were appropriate. But the aggressive public health measures to contain the few cases that occurred in other provinces were effective, I think, in controlling the outbreak in other provinces. So when we talk about phase 3 or widespread community-based transmission, we have to look at each country and each region of the country, and we have to look at the individual context. Phase 3 or widespread community-based transmission may only apply to a small area of the country. And that's why having information and having epidemiologists sort of epidemiologic studies and analysis is really important for us to understand what's going on.
But would the World Health Organization have any part in advising any particular country to declare that they are they have reached that stage?
What we do is we advise countries to do their best to improve their surveillance systems, to look for cases, because if you need to have the capacity to identify and test and diagnose cases, to understand what's going on in the community. And our message all along has been, if you do identify cases, apply the public health response. Isolate the cases as fast as you can, identify their contacts, trace their contacts, and try and break the transmission of the virus to prevent it from seeding into the community.
Yeah. And the procedure that Khun Thepchai mentioned, the graphic about quarantine procedure. So if the graphic ready, please show it on the screen.
Okay.
Yeah.
It's a translation from the Thai language guidelines.
Right. Good thing, because my Thai is very bad.
Yeah. It should be useful for people who are thinking of a self-quarantine, right? That these are the things, 10 basic things that they need to.
Extremely useful. I think what's really important is that people who are monitoring themselves at home need to monitor themselves for the common symptoms of COVID. So if they develop fever, they should try and take their temperature 1 or 2 times a day, in the morning and the evening. They should notify public health authorities if they develop fever. They should be aware of even the most minor symptoms, sore throat, slight dry cough, aches and pains that might feel like the flu. These are all symptoms that could suggest COVID, especially in someone who has been in a situation or in a context where there has been community-based transmission of COVID. So it's important.
There's a case of a well-known actor in Thailand announced that he got infected of COVID-19. And then another actress who is very close to him working together, she must be quite panicked and have herself like crying on social media that she doesn't know what to do. So what's your advice if we know that perhaps we get into contact with the infected case?
Right. I fully understand that there's a lot of anxiety and a lot of fear. I think that it's really important for people who think they may have been in touch with someone who has been diagnosed with COVID or think they may be a close contact to monitor themselves closely. They should do just what I was saying. They should monitor themselves for temperature every day. They should be aware if they developed any signs or symptoms, and if they do, they should contact their local public health authority. They should contact their local health provider immediately. I think that as long as people don't have symptoms, there's no reason to be anxious. Again, I think that it's the continuous application of the basic measures that I talked about. Hand washing, okay? Sneezing, respiratory etiquette, coughing and sneezing properly into a tissue so that you protect other people, trying to avoid touching your nose and your mouth, and trying to keep that distance. I think that, of course, it's stressful if you know someone who's been diagnosed. It doesn't mean that you have the disease. You have to monitor yourself closely. But I think in most cases, unless the contact has been repeated and close for an extended period, that probably people would be okay.
Yeah. You know that April is the festive season for Thailand, and Songkran holiday is around the corner, and this is posing a big concern for health authorities. So what would you be advised to Thais? I mean, tens of thousands of them are now planning to go back to their hometown, so celebrate Songkran, a mass movement of people.
Right.
Because so far, all the cases that have been reported are confined to Bangkok and metropolitan areas, right?
Sure. Again, I think there's some important lessons to be drawn from China here. I think it's really important that the capacity of public health officials in all of the provinces of the country is strengthened to be able to identify cases should they occur. And again, isolate them as quickly as possible, treat them appropriately, identify their contacts, and trace their contacts. That's how we deal with a situation where we have one or two cases in a community. So as people in Thailand spread out across the country, public health officials in the places where they're going have to have the capacity to be able to identify cases should they occur and interrupt the chains of transmission very, very quickly, deal with those cases very, very quickly. The second thing I would say, that's for public health officials and the public health system. The second thing I would say, again, is that every person, everywhere in this country, at every single moment has to be aware of what they can do themselves to prevent infection in themselves and protect other people around them. It's the four basic measures. If people, when they travel, can be careful, can wash their hands, use proper respiratory etiquette, avoid touching their faces, and try to keep a distance of at least 1 meter from other people, that would offer significant protection and reduce the chances of seeing this virus spread in Thailand.
Yeah, it may not be possible to stop them from traveling, but they can protect themselves against the dangers of the virus. Yeah.
And this is what we saw in China during the Lunar New Year. People they traveled all over the country. We saw cases occurring in almost every province, but this vigorous public health response, the capacity of the public health system to respond in all the provinces, was able to really interrupt transmission of the virus in these provinces. They were able to get on top of it, interrupt transmission, and now we're seeing a significant decrease in the number of cases in China as we see a significant increase in cases around the world. So I think it's testament to their capacity to respond.
And do you have confidence in the Thai's capacity to deal with this situation?
Thailand has a very strong public health system, one of the strongest in the world. I think that we need to examine the gaps in our capacities here, and we need to anticipate where the gaps are, and we need to move quickly to fill the gaps in our capacities, especially in the regions, especially as Songkran approaches. And I think if we do that, we have the best chance of preventing the spread of the virus in the country.
In China, it takes like the first case was identified in November, but then in December it's become widespread that they have outbreak of coronavirus, and it takes about 3 months until they reach the point that they have reached the peak. And right now the situation must have been getting better, as we understand. Is that correct? Do you think it will be reversing again in China, or we can be quite sure that it has reached the peak already?
It's a glimmer of hope.
Yeah. So again, it's really difficult to predict when this epidemic, this disease, the epidemic of this disease would peak in any one country. What we do know, and what we emphasize again and again, is that our destiny is in many ways in our control. if we apply these rigorous public health measures, if we apply, if every person applies these basic sanitary measures that they can do, we can delay the peak of this disease and again prevent our health system from being overburdened. So the how far away the peak is and how long the peak will last depends a lot on what we do now. It's really the moment for action now.
So you think it's better to try to delay the peak?
Absolutely. I mean, again, for the reasons that I invoked, if you have a large number of cases occurring over a very quick period of time, it can rapidly overwhelm the health systems. Health facilities will be overwhelmed. You'll have a lot of people going to the hospital. You'll have a very high demand on health services. If by applying the measures that I've been talking about, you can slow down the transmission from person to person, you can delay the peak and prevent health services from being overwhelmed. You can basically what we call flatten the curve. Okay, and our goal, if we cannot prevent the disease from coming into our communities, we need to flatten the curve so that we don't have this very sharp peak that overwhelms our health system.
But would a warmer weather help?
It's a really interesting hypothesis, and I don't think we fully understand what the impact of climate is. What we have seen, it's true, is lots of cases in temperate climates that are currently in their winter seasons. So in the season that also corresponds to the flu season. So I think that may be a possibility. It needs to be studied. But I would not use that hypothesis to become complacent about what we do. We need to react as if what's going to happen here has happened in other places.
What's the lesson we can learn from the last outbreak, from MERS, from SARS, from H1N1? You said we have to try to delay the peak, but obviously people around the world must be quite anxious and cannot wait for it to be over. They just want to get past this stage as soon as possible.
Of course.
Even from your fight with Ebola.
Yeah.
Yes. Absolutely. No, I think you're right. I think what are the lessons we can learn? I think, again, the lessons are all about public health preparedness. Countries need to invest and develop strong public health systems, much like Thailand has. I think part of the success so far of Thailand's response has been the fact that it does have a very strong public health system, strong laboratory capacity, strong capacity to isolate cases, to identify, isolate, and cases and trace their contacts. So I think it's having a strong, robust public health system is so important. This is a lesson we learn every single time that we face one of these epidemics. You know, the other thing I think that we have to understand is this will pass. Like everything else, we don't know how long it will take. We don't know how long. We don't know whether we'll be living with this virus and for how long. But it will pass and things will return to normal.
But what about the vaccine that we have been talking a lot about?
Right.
The Thai is going to have come up with a cocktail of medicine that would deal with the virus.
So I think it's important to distinguish between medicines that we could use to treat the virus and vaccines that might be available one day to prevent the virus. So let me just talk about vaccines first. There's a lot of work being done globally on vaccines. I think there are at least 20 candidate vaccines, or there are a number of candidate vaccines. There are a number of candidate vaccines. I'm not sure if it's 20, but there are a number of candidate vaccines under consideration. It's possible that we could have a vaccine available within 9 months to a year. Okay, we don't know yet, but that's possible. The challenge will be that the challenge may not be as much in coming up with a good vaccine. It will be in producing enough of it so that it would be available to everybody on the planet. It will take considerable time to ramp up production of any new vaccine because we've never produced a vaccine like this at scale on such a large quantity. So it could be several years before the vaccine becomes available to everybody. And we would probably have to prioritize certain elements of the population to get the vaccine. So for instance, those who are the elderly, those who have underlying conditions which predispose them, mean that they would get more severe infections, could be prioritized for the vaccine. But it will take some time to ramp up production of the vaccine. The other thing you talked about, and I think the thing that is most promising, and is the idea of the possibility that we may have medicines which can treat especially severe cases. And I know that there are many clinical trials, so that when we say clinical trials, there are many studies ongoing to evaluate whether or not certain medicines are effective in treating this. We'll probably have initial results on some of those in months. Again, this could take several months. The WHO has sort of a global blueprint which ensures that studies that can normally take years to develop a medicine can happen over months. And it's possible and hopeful that we might have an effective therapy to treat people who with the disease, especially those who are most susceptible to severe infections.
COVID-19 coronavirus is new virus, but there is no guarantee, isn't it, in the future that other virus won't happen again? And especially you say that it has come because of the climate change, global warming, and it can cause new virus again in the near future.
Human history is part of human history is dealing with plagues and epidemics and emerging infections. We've been dealing with this since prehistoric times. So yes, you're absolutely right, but it goes back to the message that I was trying to get across before, and that is investing in public health equips countries to be able to manage these kinds of epidemics. I mean, if you invest in public health infrastructure, if you invest in healthcare workers, if you train them, if you build capacity to do basic epidemiology, to understand disease patterns and to react to emerging infections when they come to your shores, you have the maximum chance of dealing effectively with emerging diseases and protecting your population. It's all about investment in health.
So would it be like new normal that people have to be used to COVID-19?
As I said, new normal since prehistory. We've been dealing with this ever since humans have evolved, and we will. Yes, the truth is that we will continue to face these epidemics, to face this kind of situation. Luckily, it doesn't happen often, and we're getting better and better and better at it. With increasing investment, we can continue to get better at it. But this is part of the reality of human existence on this planet.
Mm-hmm. I'm sure you must be aware of this conspiracy theory going around on it, but it has reached a new level after a spokesman of the Chinese Foreign Ministry came out yesterday and said that it was probably the U.S. military which brought the virus to Wuhan. So, as media, how should we treat this kind of, this theory, this kind of comments?
Yeah, some people, we talk about an epidemic, but we're also talking, some people describe it as an infodemic. I have 250 emails a day. We're all getting absolutely overloaded with information. Some of it is true, a lot of it is myth, a lot of it is false. Mm-hmm. We have to be very, very careful about what we conclude from what we read. Mm-hmm. We have to be skeptical. We have to, organizations like the World Health Organization have dedicated a lot of their capacity as part of this outbreak to busting myths, okay? To try to identify falsehoods, to try and identify so-called fake news and refute them and clarify the situation. So we are spending a considerable amount of time and effort in doing that because we think it's absolutely important that people have the truth. One of our goals is to provide people all over the world with the facts, to be honest about what we know and what we don't know, so that people can make their own assessments and be assured that they have the best information about what's going on.
No, but in reality, can a virus be planted somewhere without being found out? Would the World Health Organization have the capacity to really find out if this is true?
This virus almost certainly came from an animal. What we do know, what we can be almost certain of, is this virus came from an animal species. It's what we call a zoonotic infection. So it came from, it made the jump from infecting an animal, possibly the original host infected another animal, which infected humans, but it came to us from animals in much the same way that, say, Ebola. That we hypothesize that Ebola has. So that we know, and I think what our challenge will be going forward is to try and identify the species from which this virus came, and to work with veterinarians and to work with animal health experts all over the world to make sure that this jump from whatever this species is to humans does not happen again.
So for now, everyone has to take care of ourselves.
And we can do it. We can do it. We can
We have
take
questions
care of
from our audience?
Yeah, I got some, but the question is like whether the virus can be infected from food. Yeah, that was the question.
Can we get the virus from,
Yeah.
from what we eat?
You
Yeah.
cannot.
No.
You cannot. The way this virus is transmitted is through respiratory droplets. So the virus lives in small droplets in our nose and mouth, and when we sneeze, we expel those droplets. And that's how we infect other people. We either infect them directly if I sneeze into your face or I sneeze onto your hands, or if I sneeze onto my own hands and then I shake your hands and then you touch your face. So that's really how the virus is. That's the main way that this virus is transmitted. We think that this virus can live on surfaces, not for a long time, although we don't know exactly for how long the virus can live on surfaces. But we think the main mode of transmission is person to person through respiratory droplets and personal contact.
Yeah.
That means there's still a lot of unknowns, so-called unknown unknowns.
There are a lot of known unknowns, I would call them. And I mean, it's very important to be honest about what we don't know and to coordinate our research globally to answer the questions that need to be answered about this virus.
The virus must be quite good in terms of adapting to new environment and get stronger and stronger.
Viruses, like every living thing, want to survive and pass on their genetic material. So they are adapted to their environment. And what we need to do is get one step ahead of this virus. Again, we know that this virus is transmitted from person to person, okay? And we have to do everything to prevent this virus from moving from person to person. And we know how to do that.
Yeah.
And how are you and your people working with Thai health authorities on this?
So I think we work at the country level, but we work and we also work at the regional level, and we work at global level as well. So, I think at global level, we have put out a tremendous amount of guidance. We sort of act as a repository for world knowledge. We create a lot of guidance on almost every aspect for countries all over the world on almost every aspect of
Very helpful. I've seen them on the website.
So we translate, and here in the country we translate them into Thai, and we sort of help to put them in the Thai context. We have networks, globally networks of clinical doctors sharing experiences, people who help health professionals protect themselves in the work environment. We have networks of experts in that, experts in epidemiology. And what we do here in the country is try and plug those experts into these global networks and give them access to these global networks. And we again, at the global level, for countries that need it, we procure supplies, personal protective equipment as it's needed, and we distribute those. And we also help countries. And their people get information. We share information about what's going on in the world with people all over the world.
We got some comment from our audience. Kun Momo Tariko said, "You are right. In the meantime, we need to get prepared as much as we could." And Kun Maya said, "To delay the onset of transmission in the community." it's the point that you emphasize.
We may not be able to prevent it, but we must do everything we can to delay it.
Okay.
Okay, and we can see how one of world leaders, Prince Charles, he protect himself by using Thai way of greeting. So let's take a look. This is what happened.
So did he do it right?
Yes.
He did it right?
It is absolutely. Must have become a new way of greeting for people.
In Sierra Leone, we used to call it the elbow bump. We went around bumping each other's elbows. This is how it was done. So it's also, but I actually prefer the Thai way. Very nice.
Yes. And
All right.
also many organizations in Thailand are now trying to have their own like motivation program to encourage us to wash our hands. So let's take a look from BTS.
โควิด-19 โรคเข้าจากที่เมืองอู่ฮั่นติดต่อเร็วพลันผู้คนล้มตายน่ากลัวน่ากลัวอยู่ห่างไกลและระวังตัวป้องกันด้วยการล้างมือก่อนจับและถือสิ่งของนานาอาหารก็ต้องกินร้อนและต้องมีช้อนไว้เป็นช้อนกลางทำให้เป็นประจำเป็นกิจวัตรในทุกๆครั้งออกกำลังทุกวันร่างกายแข็งขันป้องกันโรคภัยไวรัสชื่อโควิด
There's always a brighter side to a crisis.
And also great for promoting physical activity as well, which I know Thailand is very strong for.
Yes. Okay. Thank you very much, Dr.
My
Daniel,
pleasure.
for
Thank you so
joining
much.
us.
Yeah,
Thank you
thank you so
very
much.
much.
ขอบคุณมากครับ
ค่ะขอบคุณค่ะ And okay, don't forget to wash your hand and stay away from the person next to you 1 meter. So we have to stay apart next time. Thank you very much for watching us Thai PBS World tonight, and we'll come back on Monday. So please watch us again on Monday to Friday at 7 o'clock. For tonight สวัสดีค่ะ
สวัสดีครับ